The floor is yours.
Thank you, Martina. Hi all, good morning. Thank you for your kind invitation today. It's always a pleasure to collaborate with Enol and all of your kind colleagues. Let me, okay, you can confirm that you can see my screen, right? Great, okay. Continuing to what Professor Pamidis said before, the Thessaloniki Active and Healthy Aging Living Lab, or Thess-AHALL in brief, has been established in 2014 under the governance of the Lab of Medical Physics and Digital Innovation, as part of the School of Medicine in the Aristotle University of Thessaloniki. So it's an initiative, an organization, an entity under the university premises. Our main focus is the development of technological and also non-technological innovative solutions in order to support the active and healthy aging of older adults, as well as to improve and enhance the everyday independent living of other vulnerable groups, chronic patients, persons with mental or physical disabilities and other disorders, as well as to provide support and high quality education, both to our medical students, providing medical education programs through our postgraduate and undergraduate programs, as well as lifelong learning courses to professionals, healthcare professionals, as well as informal and formal caregivers, and the entire ecosystem here. We operate as an interconnected hub here in the regional, wider regional level of Thessaloniki and the Central Macedonia, having multiple collaborations with the entire quadruple helix actors and representatives, from patient associations up to policymakers, the municipality, the regional authorities, hospitals, research centers, etc., trying to bring them all together in every step of our research activities to collaborate and build all together effective solutions and policies to improve health, social health, mental health, physical health here at the local level, but also nationally and across our borders. As Professor Pamidis mentioned before, we have multiple collaborations through research activities with other research centers, other organizations, universities across Europe and beyond. Of course, we're very happy because we have a very close collaboration and a central role, we could say, in Enol as one of its effective members, and we are very, very pleased because in the last 4 years we are also leading the health and well-being action-oriented task force of Enol. And in the last 4 years, we have also established our community of stakeholders, but we will say more things later in the following slides. Regarding our physical infrastructures, because our living lab is not only just a physical entity, but as part of our physical infrastructures, we have 3 main spaces. The one is located within the university premises in our lab in the School of Medicine. It simulates a real home. We call it a smart home, e-home, in order to simulate real life living environments, everyday living environments. We also have the healthcare transitions living lab, which is located in the University Hospital, Hippocratean University Hospital here in Thessaloniki, which operates as a space which can perform different activities for people who are in the transition after a long-term care from the hospital to until their return back to homes during the whole rehabilitation period. And we also have another kind of an infrastructure, the Human Centrifuge and Rehabilitation Living Lab, where we simulate different activities and conditions regarding those who astronauts experience up to there in outside Earth, and how this kind of conditions with low gravity can help people to face some kind of health and mental situations. Regarding our methodology as a living lab, we have high respect to all the values of participatory research and design, and we apply in almost all of our research activities responsible research and social innovation principles. We try to build solutions, either technological or non-technological ones, which will be interesting and useful for the society. Because as we say, we might build the best solution, the best service, the best product, but if no one needs it, it will be just a perfect solution locked in a locker. So we ask from citizens and all the stakeholders here in the local university to collaborate with us in every step of the development of each solution. And this is why we have established our local community with stakeholders, with cooperation and research community for independent living. It is a group of over 100 now members, active members, people from older age groups, over 60, 65 years old, chronic patients, as well as formal and informal caregivers, their relatives, healthcare professionals, and other stakeholders here from the local ecosystem who collaborate with us to experience and find solutions for key societal challenges related to their health and well-being. And how we try to engage them and perform all these responsible research and social innovation activities. It's through their active involvement as mutual collaborators in learning by doing activities. So gatherings in order to co-design together, to think together, and validate, pilot, test any technological solutions we develop in the lab, or other kind of best practices and programs we would like to run with them. We also very often organize educational visits with a special focus to intergeneration activities. So we try to bring together citizens and especially older adults and chronic patients we work with our School of Medicine students in order to exchange experiences and our students to understand the real needs and to build on the real needs of the city and its citizens. We also try to increase awareness outside of the university and the Living Lab, and to cultivate the culture within our ecosystem of what participatory research means, what is its value for the society and also for research. So we try to collaborate also with organizations from the city in order to have joint cultural and entertaining events in museums, outside in open spaces, in the concert hall, trying to build the city, to open their doors and welcome citizens and researchers together in their premises. And as part of our aim to increase the impact of responsible research is also these common cause events that we collaboratively organize and run with some special stakeholder groups outside in the city, in order to create and raise the awareness and break the social exclusion walls that in many cases exist for some kind of people who experience some chronic diseases, and to limit this cultural stigma, as we call it. Another
Despoina, just to let you know, you have 2 minutes.
Yes,
Okay.
As part of this of our activities is also some kind of seasonal events in order to tighten our bonds with our ecosystem and stakeholders. But all this stopped a little bit abruptly because of the COVID. But we found out the ways to run and continue our activities online. Another bunch of social innovation activities we run, it's outside in the city and through the establishment of our urban living lab. That means that we go out in the city and we try to collaborate with the local communities in order to solve key societal challenges that our city and our citizens face. It is how we call it a huge experimentation playground, the whole city, in order to experiment for our citizens and with our citizens and find concrete and sustainable solutions together. What we currently do now within the Urbanom project, trying to find solutions to mitigate the impact that the environmental impact has to our health. That was the bright idea of this was the Partnership Experience project that we ran 2 years ago outside in the city, transforming abandoned areas into green spaces with our citizens, working as an alternative research group. And the grandparent of this idea was what we did in 2017, trying to bring together Parkinson's disease patients with students in order to understand mutually and exchange information and experience mutually, and to build upon the needs of this specific group of people some solutions. We are currently trying through the Vitalize project under the project coordination of Enol to harmonize what living labs in the health and well-being domain try to do, and to harmonize all the processes, to open all the infrastructure so as to build on open access, open innovation, except for social innovation and responsible research that we are currently running. and we will have several open calls for researchers. The one is currently open, so we will share some information with you in the chat. And while one of our last recent initiatives is to see how all these open innovation, open research methodologies and approaches of living labs can be applied in the EU Cancer Mission initiative and the aims that have been set by the European Commission to standardize the patient involvement in research and innovation for cancer in the future years. And this is part of our Life Jobs event. All these things and even more things are summarized in our involvement in the City Science initiative by the European JRC, where with the municipality of Thessaloniki and 5 more cities, we try to open research to citizens and to cultivate the ground for even more participatory and collaboratively projects and initiatives in the future. So I think that was from our side, and thank you.
Thank you very much, Despoina. We are ready